That's great.
Excellent. Yes, thanks to everybody for joining. So this is being recorded. We'll be able to share this later with others. And I think a few more people might join, but I'm William Masters from Tufts University. Really happy to be able to join Amos Lahr and the whole Africa Fern group. Been able to have lots of conversations with the INFORMAS team, despite the time zone issues. Of course, that group headquartered in the other side of the world from us here in Boston. It's 7 a.m. here. And I've been working very closely with Rachel Gilbert, also on the call. You see her video on this Food Prices for Nutrition project. So you might have seen some of the materials. In particular, it's our methods that are that we use to calculate the 3 billion number who cannot afford a healthy diet around the world using the 2017 ICP prices that Rachel will tell you all about. And within countries, able to monitor seasonality, able to monitor spatial differences between markets, and all the aspects of the food environment defined as the availability and prices of items at a given place in time. So most of our work is national average over an entire year. A lot of it is month by month, and some of it is even week by week or market location by market location. And of course, that complements the INFORMAS food price module and the other kinds of price analysis that get done by nutritionists, by public health people, by agriculturalists, and I expect by many of you. So the goal of this conversation is to talk about the full toolkit of food environment research that could use food prices and availability of items, the composition of those items, their food groups, to be able to think, is the food environment meeting people's needs? Our work at Food Prices for Nutrition focuses on undernutrition and the affordability of the least cost but healthy items. Other research would focus on the competing items, the junk food or less nutritious food that might be more or less affordable and more or less displacing of the healthy foods. So I expect each of you has very different kinds of research agendas, very different kinds of policy engagement, very different kinds of community activity that you might be working on. And our goal today in these 2 hours is just to talk about that, talk about your agenda, your research questions, your professional commitments and engagement, what you are doing and might want to work with. So I see there are some francophones perhaps on the call, Idrissa Kabore, perhaps others. I hope the translation is working well for you. Si vous voulez m'engager en français, je peux parler français. Vous pouvez m'envoyer un mail à william.masters@tufts.edu et on pourra communiquer directement en français. But for Anglophones, which is the great majority of this group and the great majority of our work, what we'll do today is to hear first from the INFORMAS side about the food price module that they use. And that, unfortunately, is recorded from Sally Mackay just because of scheduling conflicts and the time zone issues. And then Rachel Gilbert will present the corresponding methods and data used for the Food Prices for Nutrition project. And then she will lead a discussion amongst yourselves. I had expected to stay. Unfortunately, overnight, I had an emergency. My father actually went into the hospital. So I'm about to get a call to find out exactly what we should do. I don't think it's serious, but I do need to be off the call to receive that. But Rachel has a lot of experience doing this. So I'm sure you will have a very rich discussion and I'll be able to hear the recording afterwards. But I think we should start with the INFORMAS food price module, which will be presented, as I said, by Sally Mackay in a video that I believe Annabelle has ready to play. Amos, is that correct?
Yes, either Gideon or Crystal. Are you guys ready?
I have it queued up. I have it
okay,
queued
so
up.
Okay, Crystal, go ahead.
Excellent. Thank you so much.
Okay, so Crystal, it appears it's not playing at this time.
Oh, it's not.
I could try it from this end if
It's not. You don't get the sound out of it.
no.
Did you get the screen? The share screen?
See, we see the screen, but not we don't hear.
Yeah. Oh,
Okay, let me try from this end.
okay.
And please, so I'm so sorry. So just confirm, is it 14 minutes, 8 seconds? The version that you have?
Yes.
Okay,
14:18.
14:18. Okay, so thank you. I'll try to play it from here. Yeah, 14:18. Good.
Yeah.
Greetings. Welcome to this presentation on INFORMAS Food Prices. I'm Dr. Sally Mackay from the University of Auckland in New Zealand. I'm going to be talking about measuring the cost of healthy and unhealthy foods, meals and diets on behalf of the Food Prices Module Leadership Team. And I'd particularly like to acknowledge Professor Amanda Lee from the University of Queensland, who created this Food Prices module. I'll give you an overview, talk about some policy implications, then describe the minimal and the optimal approaches. I'll talk about sources of food price data and some ways of adding sustainability measures. So it's very important before you actually start the research to think about why are you doing it and what are some of the policy implications, because this can impact the choice of methods that you use, where you get your data from, and how you analyze it. Some in this is using the data to model the effects of taxes or subsidies. For example, if you took the goods and services tax of fruit and vegetables, what would that do to the cost of a healthy and a current diet? Many countries want to look at the difference in costs of a healthy food basket in different regions, particularly rural and urban. And also monitoring the affordability of food for different population groups. So bringing in household income for different groups, or maybe people that are receiving social welfare benefits. Looking at the feasibility of following new advice, for example, if we're encouraging people to eat more sustainable diets, what does that do to the cost? And then looking at the effects of types of prices on diet costs. So for example, some countries have a lot of discount prices and some countries have a lot of generic brand or private labels, supermarket labels that are often cheaper. So the INFORMAS approaches, prices, meals and diets. So prices is the minimal approach, and this is looking at price changes over time, and I'll have another slide where I'll emphasize why. So the price changes of healthy foods and unhealthy foods. And the way you define healthy and unhealthy is really dependent on how you do that in your own country. The meals approach is not commonly used. It's looking at the cost of common takeaway meals compared to their healthy homemade counterparts. And this can include the cost of meal preparation time, because convenience is one of the key drivers of why people choose takeaway meals. So the recommended approach, if you have the data sources and the resources, is the diets approach, or the optimal approach. So this is comparing the cost and affordability of healthy and less healthy current diets. So first of all, starting off with the minimal approach, and I'm going to give you some examples. So the Food Price Index in New Zealand, we have done that where we have every month the food prices of 100 foods are published. It doesn't tell you the exact specific food. So for example, it might have pasta rather than a spaghetti and a brand. I classified these as healthy and unhealthy and by level of processing, and then analysed the changes over time. And I have a graph to show you about that. In Mexico, they have also looked at this, and so the bottom publication here on this list, price trends of healthy and less healthy foods and beverages in Mexico, is also looking at the food price index. Some countries have used the household budget survey. So, for example, in Brazil, have used this to look at the mean prices of foods and beverages purchased at supermarkets. Research question, and others have looked again in Brazil at the association between price of ultra-processed foods and prevalence of overweight and obesity. Other countries have also done this. So again, it really depends on the research question you're trying to answer as to how you do it. So one of the challenges of the minimal approach is that it really depends on what unit of measurement you use. So this is a graph from the USDA, which looks at the cost of food by calorie, by edible gram, or average portion. And if you look at the green bars, the vegetables, you can see that if you're looking at it per 100 calories, then vegetables seem very expensive. But if you look per edible gram or per portion, because of course vegetables don't weigh so much, and well, because they're not so energy dense, they're a lot cheaper. So it really depends what metric you use as to what answer you get. So this is why we recommend looking at the cost over time, so the metric is not important. So this is an example of this from New Zealand, where we looked at categorised food as healthy and unhealthy food. So we had 150 foods, and looked at the price every month. Shows every 3 months here. So the lighter colour is the healthy food, and of course this has more fruit and vegetables. So you can see that there's more peaks and troughs with this. Now, this was statistically analysed for change, and there was no difference in the trend between healthy foods and unhealthy foods. Now, some optimal approach examples. So one of the common ways is the market basket approach, and this has been used a lot in Australia. Creation one healthy and one current diet based on national recommendations and information from a nutrition survey about the frequently consumed foods. In some countries, there are no recent nutrition surveys, so this does make it challenging, and there you would need to cross-check with other methods like the food price index or sales data as to what those frequently consumed foods are. Food prices are collected and the cost of each diet is calculated. This approach, however, only gives you one price. So one price of a healthy diet and one price of a current diet. And of course, there are different combinations of foods that will end up in a range of prices, which is why in New Zealand, we have used the diet cost program. So this models combinations of common foods to provide diets that meet constraints on the nutrients and also the amount of foods. You don't want to end up with lots of cabbages in your diet that is an unrealistic amount for people to eat. So we've used that in New Zealand. We've also added greenhouse gas emissions, which I'll explain in another slide. And Mexico and also Belgium have also used the diet cost program. Some countries have used their household expenditure survey and created diets from this and converted it for household members, and used linear programming and Monte Carlo simulation. And so the references for these papers are down below. So looking at some results from Australia. So this is looking at a current diet for a family of 4 and a recommended diet, so healthy, equitable, and more sustainable. So you can see the difference in the types of foods that are there. The prices were then collected from the stores, and household income was calculated. And what was found was that the healthy diets were not affordable for low-income families, but neither was the current diet, and was actually more expensive. So the healthy diet was more affordable. What's interesting is breaking it down into the food groups. where the cost comes from, and you can see the pink and the red in the current diet. So these are the discretionary foods, are quite a large proportion, 58% of the family food budget. So the one good thing about doing the optimal approach is being able to look at individual food groups. Also, as I've mentioned earlier, looking at different regions, so cities and remote areas, and looking at levels of disadvantage. So here you can see that in the most disadvantaged areas and the very remote areas, the current diet is actually very expensive. So given that healthy and sustainable diets, particularly with the major climate issues that our world faces, we're exploring methodology to add sustainability measures. So in Latin America, there is an IDRC grant that is funding some research to look at different methodologies to add these sustainability measures. So in countries with good nutrition survey data, and in countries using household budget studies. In New Zealand, we have added sustainability greenhouse gas emissions to our diet cost program and calculated the cost of healthy and sustainable diets in New Zealand. And these are the results here. So remember, with the diet cost program, this is a range of costs. So it models a range of diets using the same frequent foods. And we added flexitarian and vegan diet patterns based on the Eat Lancet report, attached greenhouse gas emission data to each of the foods, and then put it through the diet cost model. So you can see here that as the diet gets more sustainable, it gets more expensive and it has less greenhouse gas emissions. So the vegan diet is the most expensive and the most climate friendly. So this sort of work is important as we're trying to move our population to more sustainable diets. It's not very equitable if they're going to cost more and only some of our population can move to that. Now, I wanted to talk a little bit about the sources of food prices, because obviously this is key. Traditionally, we've collected them in supermarkets and retail settings. A person's physically gone in there and collected the prices. But as we have a lot more online shopping now in some areas, there are other ways that this can be done. The food price index, as I've mentioned earlier, some countries, however, do not have enough detail within their food price index or enough prices publicly available. A home scan panel can be used, which provides sales data, but often you've got to pay for that. And some countries have a national food price database. There are some novel approaches to collecting prices. For example, in Australia, a price tracker database, which had data on 15,000 food and beverage products and scraped this from 2 major Australian supermarket chains. This gave price data, including promotions, nutritional information, and things like images. So very, very comprehensive. Completely different way of doing this is using citizen scientists, which can be quite important in remote community stores where you want to really look at the price in a particular region. And so this has been used in Australia. So if you're thinking what approach can you use, first of all, I guess thinking what are the policy questions is a good place to start off. What are your sources of price data? What definitions and guidelines does your country have for a healthy food and a healthy diet? Do you have food consumption data? Like, can you build a current diet? Do you know what people are commonly eating? Do you have sources of emissions data? Some countries have good data, but for other countries, this can be a challenge, and how you need to consider how relevant it is to use data from other countries. And last, but definitely not least, what time, resources and expertise do you have? Some of the methods can be quite time consuming, and so that can really determine what you end up doing. And we have a food prices module leadership team with representatives representation from around the world, which is fantastic. We meet every few months. We alternate the time because there's no one time that suits us all. And in Africa, we do have Amos from Ghana, who is part of this leadership team. So if you want to know more about food prices, if you're not quite sure where to get started, either talk to Amos or you can contact me. Thank you.
Okay, thank you, Sally. So over to you, Will or Richard.
Yeah, thanks. I'll just share my presentation. Hopefully, you can let me know if you're seeing my screen. Can you see my screen, everyone? Okay, I will assume yes, unless I hear otherwise. Great, so thanks very much, everyone. As Will said, my name is Rachel Gilbert, and I'm also here from the Food Prices for Nutrition team at Tufts University. I'm a PhD student at Tufts and also a program officer on this project. And we will start off today. Okay, so for today's session on our end, I will introduce the Food Prices for Nutrition project, the approach and the methods, and then I'll provide a few examples of how this has been used in African countries. And then we can talk briefly about a comparison of the INFORMAS approach and the Food Prices for Nutrition approach. And I will leave lots of time for discussion and questions so we can talk about everyone's work and thoughts on how to move this work forward. I'll try to monitor the chat, but please feel free to jump in with questions as I'm going. And just to orient you to the Food Prices for Nutrition project a bit, we're a 4-year project. We're a partnership between Tufts, Friedman School of Nutrition Science and Policy, the World Bank, and the International Food Policy Research Institute. So the main purpose of the project is to scale up the monitoring and analysis of food prices to guide agricultural production and food markets for improved nutrition. And I won't talk too much more about this slide. There's plenty of information on our website, but one of the key goals of this is to support the use of the metrics in high priority countries. So we'll be, we can talk about that more at the end of the session. And I want to highlight that this work actually began with partners in Ghana and Tanzania. This work began back in 2015 with a different project called the Indicators of Affordability for Nutritious Diets in Africa. And really this work started to develop the metrics in Ghana and Tanzania. So this work has a history in the Africa food environment context. So just to back up a little bit, Will mentioned this at the beginning, but really the Food Prices for Nutrition approach is oriented in the concept of food security. So instead of starting from the space of non-communicable disease prevention or obesity prevention, we're really started from the idea of striving for food security. And we know, as Will mentioned from the recent FAO reports, that healthy diets are still out of reach for many people, almost 3 billion by our estimates. And when we have this definition of food security that requires physical and economic access to not just food, but nutritious food for a healthy life, healthy diets need to be accessible. So they need to be both available and affordable for people. And that's really the motivation for monitoring diet costs and affordability in the way that we do with the least cost diets. If we want to achieve food security, we have to monitor where healthy diets are affordable and whether we're able to deliver healthy diets in each time and each place. And so that's really where this work stems from. More specifically, the central questions that we tried to answer with the Food Prices for Nutrition metrics is, if you went to a market, let's say in Ghana, how much would it cost to obtain nutritious food to meet dietary needs? And how many people would be able to afford that cost? And as you can tell, we're really focused here on markets and retail prices. And you can see here pictures of foods in markets from all over the place. And the reason for this is we know from many pieces of research in Africa and elsewhere, maybe some of the work done by people on these calls, that even amongst the poorest households, even amongst farm households that are producing their own food for consumption, people rely on markets to diversify their diets, either seasonally or throughout the year. So markets and retail prices are the basis for this analysis. And as Will mentioned again, the focus of the Food Prices for Nutrition project is least cost diets. I'll talk a little bit more about that in just a second, but we use 3 least cost diets to answer those questions about availability and affordability. The first is the energy sufficient diet, or the cost of calorie adequacy. That's the minimum cost to meet energy requirements using the least expensive starchy staple available in a country. So that might be how much it would cost to use just maize or just rice, for example, to meet an individual's calorie needs. So it's sort of a cost of basic survival. In the past, this was used as a measure of food security. And as we know from our definition, it's really not sufficient to look at energy needs as a measure of food security. This is just a baseline cost of what it would need, what you would need to meet energy needs. The next diet is the nutrient adequate diet, or the cost of nutrient adequacy. And this metric reflects the minimum cost to meet not just energy needs, but also nutrient requirements for 23 different macro and micronutrients. This is a calculation that requires sort of advanced statistical software to run the linear programming that will meet both cost constraints and the nutrient constraints. So how you can actually achieve all of those 23 nutrient requirements at the lowest cost. And the final metric, the cost of the healthy diet, which we'll be talking about mostly today, is also known as the cost of a recommended diet, or you might have seen it called CORD before. But this is the minimum cost to meet food-based dietary guidelines, which are based on food group recommendations. And this is a behaviorally realistic way to meet nutrient needs. So this is the type of advice that governments put out to help people actually meet their nutrient needs, as well as other needs. So things like proportionality of food groups, norms, and of course, the protection of health against NCDs, which is also a purpose of food-based dietary guidelines. So these are the 3 least cost diets we estimate. And a few more thoughts on least cost diets, because I think it isn't a big difference from the INFORMAS food prices module approach. Least cost diets do look at the most affordable or the cheapest combination of foods that meet the criteria. So for each one of those diets, we're always talking about the least cost. And the reason for this is, again, the orientation of coming from a food security perspective, where we're talking about affordability of the least cost healthy diet, in this case, as a measure of food access. So availability and affordability. And these food access is, of course, a necessary component of food security. It's not sufficient. There are other aspects of food security, like food safety, that are not a part of the conversation today. But that's the reason, the rationale for using least cost diets, as opposed to just the cost of an average diet. Now, I do want to emphasize that there's no standard diet or basket when looking at least cost diets. So depending on the time period and the disaggregation spatially of the data that you have, foods are chosen at each time and place. So your diet in January of 2021 might not look the same as the diet that's available in May of 2021, because some foods may be less expensive in each month, and those will be selected into the basket. So just to demonstrate this a little bit more concretely, this is the composition of a least cost diet in Ethiopia. You can see that this graph is showing you the kilocalorie contribution of each of these food groups. And just as an example, here between 2003 and 2004, you can see the contribution of pulses, nuts, and seeds in green. And then if you can see that there's some variation within that year, but let's say you're comparing it to 2008 and 2009, you can see there's a big change in how much starchy staples or pulses, nuts, and seeds contribute to the basket. And that's because of the change in prices. So the least cost diet selects different items in at different times of year. And the final point I'll make about the least cost diets is that these really provide a conservative estimate or a lower bound of what the cost would be per day. So adding in things like preferences or convenience, which Sally also mentioned, would add to the cost of the diet. So our main point is that diet costs still prevent many people from achieving healthier diets. So as people are attempting to go from just meeting their basic calorie needs to meeting their nutrient needs to meeting the needs of a healthy diet, we see rising costs as people try to achieve these different levels of diets. And the important takeaway from this is that if all diets are affordable to people, prices are just one of the many things that influence how people choose foods. You know, convenience and preferences matter. But when healthy diets are not affordable, food prices just are an insurmountable barrier for people to improve their diet quality or to climb up this ladder, which is, again, the reason for the focus on least cost. And let's see, do I have any questions? Okay, so Sally mentioned some examples of food price data, but I want to mention that in the Food Prices for Nutrition project, we are not collecting new food price data. We are relying entirely on existing retail food price data to do our work. And this is in part because food prices are collected all over the world already, and it's a huge effort to do that. Many countries are doing that for various purposes. So, for example, many countries have market information systems. So agri-food agencies, for example, like the Ministry of Agriculture, may be collecting these for their own monitoring purposes. Sometimes these are farm gate or wholesale prices, but oftentimes there are also retail food prices, either of basic commodities or a larger set of food items. So for example, we have just an image of the market information system that's available online in Burkina Faso, and that's provides food prices as well. Early warning systems also collect retail food price data. So these are systems that are meant to guide food aid and emergency interventions, and organizations like the World Food Program collect food prices, sometimes of staple or basic foods, but increasingly a wider variety of foods at markets in vulnerable areas. And these prices are collected very rapidly to help guide these interventions. And there are opportunities to use that data. And then, as Sally also mentioned, and this is really a main focus of our work at the Food Prices for Nutrition project, is the food price data that is collected by national governments for the Consumer Price Index. So these food prices and other prices are collected by national statistical organizations to monitor inflation and among other things. And because these prices are based on expenditure shares within the population, they are by definition culturally appropriate and frequently consumed products. And governments spend quite a lot of time and money collecting these data, often at nationally representative markets or representative markets, and on a pretty frequent basis, so monthly or even on a more frequent basis. So this is a huge amount of data, and the focus of the Food Prices for Nutrition project is to leverage the data that already exists to monitor and track the cost and affordability of diets. So I think that's all I'll say on that for now. Yeah, so there's also, you'll notice in these food price data sources, there's less emphasis than in the food prices sources that Sally mentioned in her presentation on processed foods and supermarket prices. That is not uniformly true. It depends on the data collection instrument in the country, but many of these systems are collecting food prices in open markets where there may not be as much of a variety of processed foods, and we're really looking at less processed items in these data sets. And I wanted to mention, because Sally also said in her presentation that oftentimes CPI food prices don't have a full list of foods or may not have these prices available. So the first thing is that a goal of our project is to find ways to make this data more available and set up a system in which people are able to use these types of prices. But another key feature is that looking at missing prices or expanding the food lists that countries or these other organizations are tracking is a goal of ours as well. It's very important to notice when and where food groups don't have data. So they may be missing data because they're not being collected. They may be unavailable foods, or they may just be too expensive, so they're not included in least cost diets. But you'll see here in this figure, this is from the SOFI 2020 background report. There's data from missing price observations for each food group in Ghana, excuse me. And you can see that dark green leafy vegetables were not frequently tracked in Ghana. That's an important piece of information. It either tells us that that data needs to be collected, or it tells us possibly that that type of food is not available. If it's not being tracked, then it might just be missing data. And that's good to know, because if food is not available, that can guide investments in these foods where market opportunities exist. So how can we get more dark green leafy vegetables to people? And during the Yanda project, which I mentioned earlier, Ghana's Ministry of Food and Agriculture actually worked with and piloted and implemented an expanded list of foods in their monitoring system in order to be able to track the cost of a healthy diet. And so it is possible to work with those who are already collecting food prices to expand the lists of what they're collecting. Okay, so now I'll just transition. I'm going to talk a little bit more about this indicator, the cost of a healthy diet, because this is the main monitoring indicator that we focus on now in the project. So just to give you a very quick intuition of how this is calculated, the healthy diet, as I mentioned, is operationalized as a recommended diet. So it's based on food-based dietary guidelines, and they need to be quantitative in order for them to be costed out in a least cost diet. Not all countries have them, but an example from the continent where there are quantitative food-based dietary guidelines, or Benin has these, and you can see here the things that a quantitative food-based dietary guideline provide that are necessary for the cost are the different food groups. So we have here cereals, meat, we have vegetables, fruits, etc. And then you can see that it also provides information on the number of portions that are recommended per day and the grams per portion. So that's the information that's needed from food-based dietary guidelines. Our project has used the Benin food-based dietary guidelines in other countries, and we're also working on a aggregated dietary guideline, which is going to be possible for people to use across countries for comparison, or for countries which do not have their own food-based dietary guideline to use. So there are many of those, but for many of the examples that I'll show you, Benin dietary guidelines are used. And just very quickly, an overview of how the cost of a healthy diet would be calculated. The first step would be to take your food price list and categorize each food into the food groups of that selected dietary guideline. So the food groups I just mentioned in Benin, each food price is categorized into those categories. The items that are not required for a healthy diet are removed. So for example, sweets are just things that add to the calorie the overall calories without contributing to the healthy diet. So those are not included in the least cost diet. You calculate the price per day for each item, which I'll just leave it there for now, but that involves using the serving sizes and the recommended amounts. And take the average of the 1 to 3 lowest items in each food group. So depending on the food group, a different number of items are included to make sure that there's diversity within food groups in the diet. And then the cost is summed for all food groups. So I'm laying this out just to show you the simplicity of this indicator. We mentioned earlier, and I think Sally mentioned it for some indicators as well, sometimes it's necessary for the cost of a nutrient adequate diet, for example, to use statistical programming software, to use the linear optimization process. This is a very simple indicator, and that is by design because it's meant to be used for monitoring. It's also this way because the dietary guidelines allow for the costing in this way. So now I'm just going to run through a few examples of how this indicator has been and can be used. The first is from, in a moment, I'll also share the link to the Sophie background report in the chat because these examples stem from there. I see something in the chat. Okay, I'll address that in a little bit. But the first example is of looking at regional variation in the cost of a healthy diet in Tanzania. So this map shows the average cost by region. And you can see here that there's a lot of regional variation in the cost of a healthy diet. So the costs in those areas where it's more expensive are about 35% more expensive than the average cost in the southwest of the country. And this is important because what you can do with the cost of the healthy diet indicator is to look at which food groups are driving these costs. In this case, vegetable prices are driving these high costs. So they contribute about 1/3 of the total cost in these areas. And this is a helpful thing to know when you're trying to figure out what to do about the high cost of a healthy diet. And we also look at affordability of diets. As I mentioned earlier, the different metrics are calculated by looking at the cost relative to an income standard. So here I have a list of the potential income standards that you could compare the diet cost to. So for example, national poverty lines, international poverty lines. You could use food expenditures from a household survey, also recommended in the INFORMAS module, income or wages. And this was used in Ethiopia to look at the affordability of a healthy diet. So comparing the cost of the diet to daily wages. So these are daily wages for unskilled laborers from government data in Ethiopia. And you can see in this graph that what's been done is to compare the cost as a percentage of wages. So this green line here, which I've highlighted in the box, is showing the cost of the diet as a percentage of wage, and it's going down over time. And what's very interesting here is that affordability improved over time, but that affordability is actually not because food is less expensive. It's just because wages are increasing. And that's a really important thing to understand, is that if we're focused on affordability, we can look both at the income standard and at the cost. So you can see here that costs rise slightly over this time period and wages increase much more quickly. So as I'm wrapping up, I just want to think about how these diet cost metrics can enter into a policy dialogue around food environments. I mentioned in the Tanzania example that food group specific price spikes, for example, or unavailability, they could motivate investment in agriculture or in infrastructure, for example, storage, warehousing, roads, or in trade. So being able to look at the different costs of food groups allows for a more nuanced policy dialogue. These metrics can also help highlight specific needs for social protection. So when we're talking about affordability or availability of foods, some possible responses might be homestead food production for certain items. You might also think about cash transfers, or if we know that there are price spikes that have a seasonal pattern, so at the same time every year this food group is more expensive, that can highlight specific social protection needs and timing. And again, with these examples, you can see that there's regional differences. So disaggregating things at different marketplaces or different districts or regions can help design sort of different interventions for different locations. And the final point is that this information can be used to think about what an appropriate poverty line is, or what the appropriate metric is for inclusion in different safety net programs. So if we want people to be able to afford a healthy diet rather than just basic calorie needs, we might think about adjusting these metrics. And so now to transition a little bit to the comparison, both to INFORMAS and to other initiatives, which you may have heard of, particularly others that use least cost diets. The food prices for nutrition approach differs in that truly the emphasis here is on monitoring. So as I mentioned before, the cost of a healthy diet doesn't rely on complicated methods like linear programming. It's a relatively easy metric to compute, and that lends itself to monitoring this frequently. We're focused on leveraging the data that's already being collected by national and international monitoring systems, and supporting countries to calculate the diet cost and affordability metrics within their own data systems. And we're moving beyond individual nutrients or individual foods to look at healthy diet patterns. So many of these other initiatives, as we also do with the cost of a nutrient adequate diet, are focusing on the cost of nutrient needs. So for example, fill the nutrient gap and cost of the diet have done that. And we're actually working with WFP to incorporate the healthy diet metric into their work as well. But this healthy diet pattern is useful, particularly because for the context of this group, where many people are interested in NCD prevention and obesity prevention, food-based dietary guidelines and diet patterns are designed to meet nutrient needs and to protect health in the long term against NCDs. And then the final point is that really we are focused on least cost diets rather than just current diets or the average cost. So this is just an overview from my perspective, and I'm very interested to hear what other people have to think on the differences between INFORMAS and food prices for nutrition. And here actually there are some similarities as well. So I won't go through this in too much detail. We can talk about it to the extent that people are interested in doing that in a little bit. But I think, again, a few interesting things to note are this starting point for INFORMAS. It really was from the obesity and NCD prevention angle, and we're coming in from more of the undernutrition side, where we're focused on achieving food security and food access for low-income consumers. And I think INFORMAS has a bunch of different focus points. So while there are individual foods, there's also meals and whole diets, where we're focused really on the whole diet and disaggregating into food group level. And I'll skip down actually to the unhealthy foods in the last row here. I think this might be an interesting point, and I think it links to the message in the chat, which I'll get to in a little bit, is that in INFORMAS, my understanding is that the foods approach specifically categorizes things by healthfulness, level of processing. So you're looking at healthy foods versus unhealthy foods. That's not something that specifically happens within the food prices for nutrition approach. There's no specific categorization of unhealthy foods and comparison of them. But as I mentioned, foods that are not required by the food-based dietary guideline are removed. So for example, sweets or alcohol are not included in the cost of a healthy diet, even if those things are being consumed are being consumed within the population. So the way that those would show up is if you're doing a comparison of the least cost diet to current diets, looking at, for example, consumption data from a income and expenditure survey or household survey data. So we can come back to this if people want. I think I've mentioned it all before, and I want to get to discussion. So I think the takeaway for me from hearing about the INFORMAS module and what we know of the food prices for nutrition module is that these are complementary approaches. So we need, I think, two different things. The first is easy to calculate metrics with existing data that can be used for monitoring. So we have an understanding of things on a frequent basis. And then, of course, we need in-depth analyses to guide interventions and behavior change. And I think a mix of the food prices for nutrition and INFORMAS approaches can provide a lot of information. So least cost diets can serve as a benchmark for understanding that conservative estimate of what access to a healthy diet costs for the most vulnerable. And very open to thoughts on this as we move into a discussion. So let's see. Just quickly before we move into discussion, I want to give people information about our website, just so people can find more information. We do have, oops, going the wrong way here. So you can find our website using that bit.ly link at the top. And then we have a lot more information on the metrics and some information on resources to calculate them on the methods section of our website. We have a research tab, which has some of our work, but also links to similar work that's being done. And on the engagement tab, we have country webinars. One of them is also from Burkina Faso, and it's conducted in French for our Francophone viewers. So I'll just leave that in the chat. And we also are creating food price user groups for those who want to better interpret the metrics, but don't necessarily want to calculate them on their own. So you can join those via our website as well. And then the last thing is just that you can contact us through the website, or you can email me directly at any time. So I'll also put my email address in the chat. But I'd love to open things up for questions and discussion. Please unmute yourself, turn on your video if you're willing and able to ask a question or make a comment. And I'll get to the question in the chat in just a moment. Thanks, everyone. I'm just putting my email in the chat in case everybody needs that. So I'll go to the question that's in the chat while I wait. It seems like not collecting prices on processed foods is the choice, if I understand correctly. An example is the sweetened beverages or fried snacks sold by the road. These may not be sold in the center of a market, but they are sold widely. Do you have a sense of how much this is overlooked by not including processed foods in the activity? So I just want to clarify, it's not that processed foods are not included. What I meant to say, I don't have a sense broadly across all of the food price data that is collected. I meant to say, and I hope this comes across, that processed foods would not be the primary item that's collected in, for example, some CPI data. It would be more things like raw vegetables, raw fruits, grains. Some of those might be milled grains, for example, but it might not be like specifically branded items. And I think that I'm not entirely sure the extent to which things like sugar sweetened beverages or fried snacks sold by the road are included in those things, because really the focus is on expenditure shares for something like a CPI. So the more heavily consumed foods are more heavily weighted in the CPI, and therefore would probably be more of a focus for data collection systems. But I think many countries collect food lists up to like 150 items, 60, 150. So there could certainly be processed foods there. And I know that beverages, particularly those that are commonly consumed, are included in some food price lists. Go ahead, yeah.
Okay, thank you, Rahel. Thank you for presentation. I will have some like clarification on the method of measuring the price of different food, even the inflation and the margin with the lower bound and higher bound, and how you get this cost of diet in each country. Is it a collection of diets and the cost which already people buying from different market area, supermarkets, and different street foods and whatever? So how you get the cost data? Is there any data already existed on the cost of, for example, in Ethiopia, let's say, because I am from there? So is there any cost of the diets? I know that there is a household expenditure data which indicates the national consumption somehow, and also the food consumption data which is collected by Ethiopian Public Health Institute, but it's almost outdated. So how you get the cost of data in order to manipulate in your analysis software? Thank you.
Yeah, that's a great question. So one thing which Will mentioned at the beginning of the presentation is that particularly for the SOPHI report, which is where the 3 billion number comes from and where many of these metrics, you may have seen them, the data source for that analysis, which is across all of the countries, the food price data for that is from the International Comparison Program of the World Bank. They're a partner of ours on this project. And what the International Comparison Program does is they collect the food price data from each country. So this is actually a subset or a subset of the data that's collected by national statistical organizations. And they collect that data for the purposes of comparing the world's economy. So for the purchasing power parity calculations, but that food price data is the basis for all of the cross-country comparisons in the SOPHI report, in the 2020 and 2021 SOPHI reports. And that data, as Will mentioned, is what it does is it creates a national annual average price, and it's collected every 5 years or so. So there's data on every country from 2011, 2017, those are the most recent rounds, and there's another round of data collection ongoing now. So that's where some of the data comes from, the SOPHI report. Now, the case studies that we talked about, so for example, Kilo, you mentioned the Ethiopia example. Sorry, it's the problem with using animations. So in the affordability analysis done in Ethiopia, this is data from the Central Statistical Agency of Ethiopia. These are their food price data. And that data was shared. I'm not entirely sure what the relationship was in order to get the data, but this is data that was shared by the Central Statistical Agency for the purposes of this analysis. And so the point that I was trying to make earlier with the use of existing data is that there are places, particularly where you can ask to use the data. Now, many countries don't share their CPI data, but many do. And there's also the market information systems data, for example, like in Ghana, the Ministry of Food and Agriculture and the Ghana Statistical Agency, both are collecting food price data that can be used. So some places that food price data is made available for people to use, and it's can be gotten from those organizations. And part of the goal of our project is to increase the availability of food price data collected by national governments, perhaps not all of it, because there's a lot of concerns within countries around sharing all of the information that's used to track the consumer price index and inflation. But for the cost of a least cost healthy diet, you don't need 160 foods. You need honestly about 11 foods to calculate the least cost diet. And so sharing a subset of sentinel foods to track is a possibility. And that's something that our project is working on. So Keith, I'm not sure if that answers your question. I hope it does. But the real answer is that this is data from the Central Statistical Agency of Ethiopia that was shared for the purposes of the analysis. And the ICP data from the World Bank, which is the national annual average price, was used in the SOFIA report. And that data from the World Bank is available to researchers upon request.
Okay, great.
Yeah. So, okay, I don't see other hands or comments in the chat. I will go back to my discussion slide. I do want to hear from people what you think the opportunities are to use food prices within your country or your organization. And a possible other question is, what's needed? What next steps do people think are necessary? And if people want, we can also talk about the INFORMAS module relative to the food prices for nutrition approach. So Amos, if you're here, I might pick on you and ask you for your thoughts from Ghana. Oh, I think we might have lost him. Okay, Amos isn't there. Okay, no thoughts. Well, I guess I can talk a little bit about what's needed on what we view as needed on our side from the Food Prices for Nutrition project, because I think, as I've mentioned here, we have the methods have been developed, but what we're working on now, among other things, are tools to help people calculate the cost of a healthy diet. So some of those are available on our website, but those also include a database which will be used to translate dietary guidelines into the recommended amounts which are needed per person per day. So usually people have to link food prices to food composition data to a dietary guideline. And the database that we have developed makes it easier to go from a food price list, so where you have, maize, rice, milk, powdered milk, dark green leafy vegetables, directly to the cost of a healthy diet by providing the recommended amounts. And that's a tool that we're working on that some of you may have been in the ANH Academy Week presentation. We debuted some of that there, and we're refining that tool now. So that's one thing that's needed. I think a big barrier to using food price data is what Keithley mentioned, which is first just getting the data. And that requires talking to people, asking for the data, or in the INFORMAS approach, also collecting one's own data. But on top of that, there's a big barrier from getting just from the food prices to an end metric, and food composition data is often hard to use and time consuming. So we're trying to reduce the friction by helping people get to the metric. Does anybody else have thoughts, or does anyone want to comment on difficulty they've had using food prices? Oh, Amos, great.
Thank you, Rachel. I just noticed there's an error in the timing. The time that was allotted to this, I think you've been shortchanged by 30 minutes. And I was wondering what would happen. I think when it's about 1:30, the session might stop. I will try to pause it just a minute at a time. I wanted to find out, would you need all the 2 hours?
No, nope. I mean, we're just ready for discussion and questions now. I'm done presenting. So we don't necessarily need more time, but I do see some comments. It would be great to hear from people, and we can
Thank
certainly
you.
discuss, but yeah, I'm all done.
And that is fine. If you needed 2 hours, I should be able to pause it. I think at about a minute to 1:30,
Okay.
I can pause it and you can go. Thank you. So please continue.
Okay, great, thanks. Okay, I see some hands. I see Francis.
Yes, thank you, Rachel. Very insightful and excellent presentation. My question relates with the role government can play in helping to address the actual calculation of the food prices. The reason I say this is because there are price variations regionally, as you talked about the Tanzanian case situation. The food composition tables would also go a long way to help, because with the food composition tables, we are able to know the nutrient content of those foods. And then we're able to then make a calculation based on the quality of that nutrient. Unless we are saying that the food composition tables or database will not be helpful, because the choices that people would use will depend on whether they would go for a particular type of food or not. And so I'm just tossing this in my mind to know how government's role in this, in making things a lot easier, the nutritious.
I think you might have cut off on the last bit, but I think I caught most of your questions. So
foods in question that we are dealing with, then people can make informed choices. I don't know if you got me clear or confused you more.
I lost you for a minute there, but I think I got most of the question. I'll try and respond, and then you can let me know if I missed something. But I think your question is how governments can be involved in making data easier to use, and also in perhaps also just tracking the costs themselves. So I think one part of the answer to this question, from my perspective and from the perspective of our project, is to make a set of information, specifically food prices, more easily accessible to people so they can use them rather than spending time and resources collecting their own food price data. It's very time consuming, and I think it can be hard to collect really high quality food price data. So to the extent that governments can make some of that data available that they're already collecting, even if it's not the full food list that they're using for their CPI, or maybe not all of the food prices in their market information system, there are countries that have online portals where that data is available. For example, I think I showed a screenshot of the Burkina Faso portal where that information can be viewed by anyone online at any time. So that's one thing. And I think you're talking about the food composition tables as well. I think it's very true that governments can do more to make that type of information available. But I think because that it's also very difficult, as I understand, since it's not my area of expertise, to come up with specific food composition tables for a country. So when they don't exist already, making available a food composition table that's country specific would also be a expensive and time consuming undertaking. What we have focused on is for the cost of a healthy diet, for example, using already existing food composition data to translate food-based dietary guidelines into diet costs. And the database, which we have under construction right now, allows people to just match the foods from the food price list once to a set of data that's already compiled on food composition and then the recommended amount per day. So that includes the number of servings per person per day, as well as the size of the portion. So that step takes quite a lot of time for the individual researcher or person to calculate. And that's why, as part of our project goal, which is to help countries and particularly governments calculate these costs and to make them available to their citizens, is to reduce the burden of calculating these things. And That's also why we've shifted a bit away from the cost of a nutrient adequate diet, at least for monitoring purposes, because it's very intensive to calculate and it requires really detailed food composition data. It requires linear programming. And that's not something I think that's feasible on, for example, a monthly basis, whereas the cost of a healthy diet is. So that would allow people to make more informed policy choices. I don't know that that necessarily translates to people making individual personal food choices, but the goal is just to change the food environment so availability and affordability improve, so individuals can make better choices at markets. I don't know if that answers your question. I hope I.
Yeah, it does. I was just a bit worried about the government being a bit aloof rather than being more involved in this, because as you mentioned earlier on, diet cost prevents many people from achieving healthy diets. And how can the government in any way help us in achieving some of these things and making things a lot more affordable so that people can make healthy choices? But you've answered my questions. Thank you.
Yeah, and I think this goes back to the way that these metrics can enter into policy dialogues. So an example from earlier is when we're looking at food price data and, for example, in Ghana, seeing that dark green leafy vegetables are not available in many places, the immediate question is, how do we make dark green leafy vegetables available in markets? And when we have price data at each market location or in each region or district, it's possible to make a targeted approach that is actually a feasible policy intervention to improve availability of a specific food group. So I think it's possible to target different things. You could also talk about which of these foods might be appropriate to encourage people to grow at home, which things are unreasonable for people to grow at home, and therefore we might need a cash transfer or some version of a social safety net to allow people to buy these items. So I think that's our goal, is to get first governments to monitor this so they know what they need to be focusing on. And then the second question is how people within each country and in the international community can use this data to advocate for specific policies, because we know that advocacy and civil society are really going to be pushing the change in food environments, I think. So maybe that's an additional piece for your question. We'd love to hear people's thoughts on that. Okay, I see 2 questions in the chat, but Saad, did you want to ask your question, and I'll take a look at what's in the chat.
Yes, thank you so much for the beautiful presentation. I don't know what I missed something, because this wasn't very good. I don't know how you dealt with, foodstuffs differ according to ecological zones, not actually according to countries. Also, fluctuating prices is a very serious problem. Fluctuating prices within seasons, within months, and even sometimes within days. How do you deal with those things? Because average prices don't really tell us much about what is really happening. I don't know how you dealt with those kind of problems. Again, sorry if you've already talked about them. Maybe I missed them when you were discussing them. But the whole idea about fluctuating prices between seasons, within months, and probably even days in some places, and also different foodstuffs across ecological zones. How do we deal with this in terms of what we've been discussing? Thank you.
Yeah, great question. So I'll start with the question of different foods across agroecological zones. I think the first thing is that I mentioned earlier that there's not one least cost diet that is set in each country. What happens is, let's say you have data on a monthly basis for 20 different markets. The way you would calculate this metric would be, you would calculate the least cost diet in each location where you have data and for each month that you have data. So the least cost diet in January in a dry area might look very different from the least cost diet in another region of the country or another agroecological zone. If prices are different in that area, that will be reflected in what the least cost diet picks up, because the least expensive food items in each category will be included. So it's not that there's one diet basket. Now, this depends on the data that you're using. For the SOFIA report, where we're using ICP prices, which are a national annual average, no, that's not possible. The reason that data was used is because it's available for 170 countries. So it's very useful for cross-country comparisons. The goal is certainly not to use ICP data for national and subnational analyses. So that's where you would want to use either the market information system data, which is usually collected at representative market locations. Some countries collect this on a daily basis. Some collect it on a monthly basis, weekly basis. So it depends on the data you have. But you calculate a least cost diet at each time and each place. So if you could do it on a weekly basis, and that would account for sort of the variance by region or location, as well as over time. Does that answer the question? I hope that's.
Yeah, it does. I think at least that's what I was thinking about, and that's exactly what I was thinking.
Yeah,
right,
and one more point is that there's a paper from this project that I can share in the chat in just a moment that looks at seasonality in Malawi, Ethiopia, and Tanzania. These are all using the National Statistical Organization data sets. What it looks at is when prices peak in different food groups and which specific foods peak at which time. So it's very important, as you said, to look at seasonality and food price fluctuations. That's a huge part of designing policies that actually make things more affordable, because it's not necessarily that everything is unaffordable or that we should just broadly provide cash. We need to target interventions. And so understanding, peak times when things are very expensive and how to deal with them, or which food groups are most expensive, is really helpful. Let me share that paper in the chat, and I should also stop sharing my screen so people can see one another. But that would be a useful, maybe that can provide some more information on how we've done it in this project. Let me answer these questions in the chat. I see some hands still, but I think Francis and Kifa, maybe those are legacy hands. And so the questions in the chat, Myra wrote, I'm trying to learn more about food environment. This topic is very interesting. Your tool seems to be for governments, so it can directly give them advice on policy. How can this tool be used for small and medium enterprises or the private sector? So this goes, that's a great question, first of all. And I think we are focused on governments, but all these metrics, first, we use them as researchers in our own work, and many others can calculate these. Even individual projects can do this in their own. For example, if you're working in a country in a specific region, using food price data for the area as part of a monitoring and evaluation system is a very useful tool. So I don't mean to say that this is only for governments. The same policy questions or intervention related questions can be answered with these types of metrics. But in terms of the private sector, I think one thing is where there are gaps in availability or opportunities to provide less expensive products or just make foods more available. I think the dark green leafy vegetables is one example. If there's places where that those foods aren't available, that's a market opportunity. That's a place where you might consider investing in production or sort of different varieties that might do better in those regions. So because we're looking at the diet cost doesn't mean that we can't look at food group and individual food items to see where opportunities might exist for more investment. And for the private sector, beyond just the food production, like the opportunities for trade or opportunities for investment in infrastructure are also, maybe there's not a good market location in a certain area where people can access these foods. So that's a possible use for the private sector. I don't know if others have thoughts on that. Or Myra, I don't know if that answers your question, but feel free to jump in if not. And then the next question in the chat, someone might need to mute, but yes, I can share a copy of the PowerPoint, and my contact information is in the chat and on our website. Let me just put a few things in the chat right now. And you can feel free, this is our website, their contact is also there, but my email is here, rachel.gilbert@tufts.edu. And I can also share, in just a minute, I can share the presentation, and we'll also post it on our website. So thank you for the presentation. The cost of a healthy diet is based on food-based dietary guidelines. Is there any way to adapt it when a country does not have a food-based dietary guideline? Yes. So I mentioned the healthy diet basket, which is something that our project is currently developing, but it's an aggregate of, I think it's 10 food-based dietary guidelines that are quantitative. And so that can be used for either countries. It's not quite finalized, but once it is, it can be used for either cross-country comparisons or countries that don't have a food-based dietary guideline. But what's been done in other situations, so I think I mentioned that in many African countries, because Benin is I believe it's the only detailed quantitative food-based dietary guideline. It's been used, for example, for the Malawi examples, Tanzania, I think even maybe Ethiopia, but it is possible to, food-based dietary guidelines have a lot of similarities across countries. So it's not that, well, it's great to have national food-based dietary guidelines. It's not that using a different food-based dietary guideline wouldn't provide interesting information. There's a lot of similarities across countries. And so it's possible to select another country's food-based dietary guideline and do the costing of that. Others have also used and are in this project as well. We've used the Eat Lancet guidelines, but interestingly, the costs are not altogether that different for some of the Eat Lancet reference diets. So that's the possibility. But yeah, it really, these metrics don't need to be limited to national food-based dietary guidelines. I think one reason that's very appealing is because national food-based dietary guidelines are official government policy and they're official recommendations that are, you know, for example, in the United States, our social safety net programs are based on the cost of achieving the food-based dietary guidelines for the United States. So that's an appealing reason to use them, but they can, for example, any country could use the Benin food-based dietary guidelines if they wanted. Okay, any other thoughts or questions before, as we're wrapping up? Thanks everyone for your contributions. I'm going to find the seasonality paper and drop that in the chat right now. So please jump in with the questions. So that I've just shared that paper in the chat. And I'll also mention that for our project, we have focus countries, and in many of those focus countries, we've conducted introductory webinars. And so there's more detail and results from some of those, for example, Malawi, Tanzania, Ethiopia, Burkina Faso. The French presentation that I shared earlier is there. And those can be found on our website at the link that I'm about to share right now. And that's also where you could sign up to be part of the food price user groups for each country. And the goal there, as I mentioned, is to help people interpret the data that is available. So for example, the data that's in the SOFI report, and use that for advocacy. And in a few months, we'll be putting more data up, actually, hopefully in the next month or two, on the World Bank Data Hub. And that will have the diet cost and affordability metrics for each country, as well as the disaggregated costs by food group. And when those go up, we will be holding meetings for people in each country of our 9 focus countries, of which, let's see, I think 6 are in Africa, to discuss how to use that data for advocacy. So Francis, that goes a little bit to your question of how we can use this information to actually get governments to change. We do work in Bangladesh. Yep, that's another one of our focus countries. And there's been some work done on Bangladesh, which you can also find on our website, or you can email me and I'm happy to talk more. So again, please reach out to me directly, or you can reach out to Will if you are a Francophone and want to be speaking in French. And I think we have about 5 minutes left, but if there's no other questions, I think people are, oh, great, Myra, yeah.
Hi, Rachel. I'm trying to learn about this, and it's really great presentation. Just want to say I will get in touch with you because I would like to learn more about this. And we're working on in Bangladesh, and this is really more of a private investment. So we're working with a company who would like to expand a bit on providing healthy diets to their customers. So yeah, I will get in touch with you by email.
Great, thanks so much. Yeah, please do. Great to hear from you.
Great, thanks.
Thanks.